A concussion happens after you get hit in the head, and by definition, the hit is strong enough to cause a disruption in normal neurologic function. So it's not necessarily true that you have to be knocked out in order to have a concussion. If you get hit hard enough to have a change in thinking, or to feel dizzy, or to get double vision, any change in neurologic function would be characterized as a concussion. Well, it turns out we don't know a lot about what happens during a concussion. So there are a number of theories that have to do with changes in blood flow, sudden interruption in normal neurologic traffic, so changes in the electrical activity of the brain. But the honest answer is we don't know why the brain function is altered so suddenly. But it's a very reproducible problem. So different people getting hit in the head often experience the same kinds of symptoms. So loss of consciousness, getting knocked out is by far the most common symptom that people are aware of. But also dizziness, feeling sick to your stomach, being confused. Sometimes you even get combative or irritable. And then afterwards having difficulty sleeping, having ongoing headaches are all symptoms of nerve damage or nerve injury that occurs as a result of a concussion. There are definitely some clues that a parent could use to help decide if you must seek medical treatment. So I would say that if your child experiences a loss of consciousness, for sure they should go to the emergency room. If immediately after the fall or the accident they're crying out in pain, and within a few minutes they're no longer crying and they're acting fairly normally, they probably don't need to go to the emergency room. But if they don't recover quickly, so the crying goes on for more than a few minutes, or if they start acting strangely, become unusually sleepy or lethargic, you can't wake them up, start talking nonsensically, or showing any signs of something that might look like a stroke, so let's say they're not moving one side of their body, or they can't talk right, they have a lot of vomiting, anything like that, absolutely, you should probably call 911 in a case like that. The after effects of a concussion can be quite varied depending on the severity of the injury. Headaches being the most common, but also concentration difficulties, sleeping problems, ongoing vertigo or dizziness, and these are all symptoms for which there are certain treatments that may be helpful. And so if the symptoms of the concussion are not resolving within about 2 weeks, it's appropriate then to seek care from a specialist such as a neurologist who can help identify treatable symptoms, which won't necessarily get you better more quickly, but will improve your quality of life and allow you to function more normally in the near term.